This is Dr. Ben White with the Rational Wellness Podcast, bringing you the cutting edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drwhites.com. Let's get started on your road to better health. Hello, Rational Wellness Podcasters. Thank you so much for joining me again today. For those of you who enjoy listening to the Rational Wellness Podcast, please go to iTunes and give us a ratings and review so more people will find out about our Rational Wellness Podcast. Today, our topic is anxiety in children with Dr. Kendra Becker. In the pediatric population, anxiety is a common phenomenon, and it is growing fairly rapidly. According to the National Institutes of Health website, 31.9% of adults in 2018 suffered with an anxiety disorder. Between 2007 and 2012, there was a 20% increase in diagnoses of anxiety among children ages 6 to 17. A survey of incoming freshmen at UCLA found that when asked if they felt overwhelmed by all they had to do, in 1995, 18% answered yes. By 2000, that number had climbed to 28%. And by 2016, the percentage that said yes was 41%. According to anxietycenter.com, anxiety is defined as a state of apprehension, uncertainty, and fear resulting from anticipation of an event or situation which is perceived as being threatening, often impairing physical and psychological functioning. In other words, anxiety occurs when we behave in an apprehensive manner, such as when worrying about a non-threatening event or situation. And there are literally hundreds of symptoms that have been associated with anxiety disorder. Though some of the more common include rapid heart rate, shortness of breath, excess sweating, twitching, insomnia, frequent urination, or diarrhea. However, in children, anxiety can be difficult to diagnose, and it's easy to mistake anxiety for a learning disorder or attention deficit disorder. Anxiety in children can manifest as agitation, restlessness, inattention, poor focus, refusing to go to school, meltdowns, crying, etc. In reality, some children may have anxiety and ADD at the same time. And children may also experience somatic manifestations of anxiety that can include stomach pain, muscle pain, or headaches. Our special guest today is Dr. Kendra Becker, who's an integrated naturopathic physician with a specialty in treating children with asthma, autism, allergies, eczema, and anxiety disorder, among other conditions. Dr. Becker teaches and lectures on various topics, including concussion, autism, MTHFR, and other genetic mutations. She's the author of 2 books, A Delicious Way to Heal the Gut, and All You Can Eat, which was just released in May. Dr. Becker, thank you so much for joining me.
Thank you so much for having me.
So can you talk about some of the reasons why we have this big increase in anxiety among children?
So I think it's really like everything else with the human body, it's multifaceted. I think, especially with the statistics that you just read, around 2007 is when they reintroduced, Common Core, which is a different learning form in the public schools. One of the biggest shortcomings with Common Core is that the way that the curriculum was set up, it wasn't set up to really match where children were neurodevelopmentally. So they were teaching children younger than their age or than their brains were developed to be able to learn the skills that were on the roster. So, and the other thing that they added was they started testing kindergartners, and the testing wasn't this kind of global comprehension. It was a very, concrete paper, write the answer, it's either correct or wrong kind of testing. And they were doing things like putting up cardboard partitions between children sitting at their desks. So they were really kind of putting a real hyper focus on this testing. So I think that in and of itself is a huge thing that really contributed to what we were seeing, as far as anxiety and the epidemic numbers. And in my practice, it was exactly the same. I had seen maybe prior to 2007, a handful of kids with anxiety that had manifested, as you spoke about, in ADD or ADHD. But after 2007, I would say probably it was about 20% of my practice. And it was just really interesting how it was literally like a light switch. The other thing is which is where my area of expertise is it's just the focus on the genetic predisposition. Our genetics don't define us, right? I mean, and I always use my 96-year-old grandmother as an example. I mean, she lived to be 96. She died with all of her teeth in her mouth. She was the same weight the day she died as she was the day she graduated from high school. She was an Italian immigrant that walked every day and ate a bunch of green vegetables morning, noon, and night. Her genetics were terrible. They were absolutely terrible. She had all the predispositions for tons and tons of inflammation, cancer, thyroid disease, none of which ever manifested in her body because of the way she took care of herself. So I think that having a genetic predisposition doesn't mean you have to own, a diagnosis. But in this case, certainly with the exogenous stress from our environment, schooling, stressful home life, whatever it is that predisposes that child can certainly play a huge role in what we're seeing as far as anxiety in little kids.
Yeah, I could understand that test score thing. I live on the west side of LA, and we're talking about a big focus on kids being super successful and being able to go to really good colleges. And there's so much emphasis on test scores, and everybody's got tutors and sending their kids to special programs for, learning outside of school, on top of paying for expensive private schools. It's amazing the amount of pressure on these kids.
Mm-hmm. I know, it's really interesting. Yet, the Bill Gateses of the world, don't allow their children to have any electronic devices and send their kids to Waldorf. And that always is so fascinating to me because, if you know anything about Waldorf, they don't really give children a pen and a paper to physically write until they're about 9 years old, because that's when the brain kind of catches up with the fine motor. So it's just a really different, learning structure. And I think, there's something to be said about that. You've seen the schools across the country that, doubled up recess or doubled up the amount of time kids have at lunchtime, and all of their test scores went up. So I definitely think all of those things are a great shakeout for kids that have anxiety.
Yeah. You wonder if all this emphasis on test scores is not the best way to be rating our schools or our teachers. And, are we trying to force kids into some narrow model that's maybe, they have this objective performance, but maybe you're creating psychological problems, and maybe we're de-emphasizing creativity, which I think is super important.
I totally agree. And I think that's a lot of what you're seeing in children is they don't fit into this little square box. And so that's where some of the anxiety comes in, even, with the kids in my practice, what I hear all the time, here's a really great story about a little girl with anxiety. At home, she's a beast, right? And so the parents schedule their conference, their parent-teacher conference, and they're like going in with the tissues and they're going in with the rescue remedy because they're sure that it's going to be a horrible, horrible conference. Well, what they heard from the teacher is that kid is an angel all day long. She's a helper. Her grades are fine. Everything that she's supposed to be doing, she's doing. But what was happening to her is she was so stressed out for keeping it together for the 6 hours that she was in school, that when she would come home, she would literally fall apart. And her symptom picture manifested in just very, very aggressive, belligerent behavior. I think she was 12 at the time. So, which is uncomfortable for parents that see that in their child.
Interesting. What role do you think social media plays in this anxiety?
So I don't know. Social media, I'm sure, plays a huge role in it. I mean, I think screen time starts, far earlier than social media. And we know, just like you said, screen time turns off the creative center in the brain. And when you're turning off the creative center in a brain that's undeveloped, and humans really don't fully develop their brain till about 25, then you're really only allowing for one path, one trajectory to really kind of develop. So I think that's definitely part of it. And then certainly social media in general. I mean, social media there's a lot of pressure for us, for adults that are emotionally well developed on social media. Who's putting out a course this week, and who had their 20-pound, weight loss transformation, and everything else. And I think, these are the conversations that you have to have, with your kids. My kids are young, my kids are 9 and 12, and they get about 30 minutes a day. My son, who's 9, gets about 30 minutes a day of screen time, and my daughter gets a little bit more based on her behavior. And so for them, I think that's enough. And in fact, for me, if it were up to me, I would say absolutely none whatsoever. But, we make our accommodations.
Yeah, no, I can see from the parents who come with their kids to see me for chiropractic. For years, there would be books and there'd be various sorts of toys. And even if they were doing something electronically, a lot of times it would be some sort of educational game. And now the parents just hand the kid a phone or an iPad, and they're just...
Yeah. We do the same thing. And it astounds me every time that I see a baby under 2 years old with a phone that knows how to use it, that can scroll through and it just is astounding to me, astounding.
I'm proud that this episode of the Rational Wellness Podcast is sponsored by Integrative Therapeutics, which is one of the few lines of professional nutritional products that I carry in my office. Integrative Therapeutics is a top-tier manufacturer of clinician-designed, cutting-edge nutritional products with therapeutic dosages of scientifically proven ingredients to help patients prevent chronic diseases and feel better. Integrative Therapeutics is also the founding sponsor of TAP Integrative, which is a dynamic resource for practitioners to learn with and from leading experts and fellow clinicians. I'm a subscriber, and this resource includes a service that will provide you with full copies of journal articles, and this alone is worth the yearly price of subscription. And if you use the discount code WEITZ, WEITZ, my last name, you'll be able to subscribe for only $99 for the year. So what are the most common symptoms you see with kids with anxiety?
So actually manifests a lot in aggression. I see that. That's what the patients come in the office for. You know what I mean? And the other thing I see a lot is the ADHD, ADD, inattentive type behavior at school. And those are the two things that I actively treat for. And I would say 90% of ADD or ADHD that I see in my office is generally anxiety in kids.
Well, how do you know that belligerent behavior isn't bipolar disorder or some other psychological condition rather than anxiety?
Because you got to tease it out, right?
Okay.
I mean, for me, you have to do for me, I do comprehensive lab work. I look a lot at genetics, so I look a lot at genetics. Family history is huge with things like bipolar and schizophrenia and things like that. And the other thing, years ago, we would say, oh, bipolar, really doesn't, take hold in a body. It's hard to diagnose before the age of 20. And that was the standard rule that I left, medical school with. And these days that is certainly not the case. You can diagnose bipolar way, way younger than the second decade, third decade of life.
So when you talk about comprehensive lab work, is there a standard panel that you'll use for all patients, or do you tailor it after doing the history?
Generally in my practice, it's one thing, as you probably know about naturopathic medicine, is that it's a very unique individual trajectory with each patient. As a rule, I do pretty comprehensive vitamin level testing and mineral level testing.
How do you do that?
Usually through blood work. Sometimes some of the standard labs around here.
Or micronutrient. Do you use SpectraCell micronutrient or Genova?
Sometimes I use SpectraCell. I generally try to start, meet the patient where they're at, and I try to use conventional lab work on the outset. In most cases, the labs are covered by the patient's commercial insurance, and it's an easy place to start with people. So I'll do just
nutrient analysis.
Absolutely. So I'll just look at, vitamin D levels, vitamin A levels. I'll look at, mineral levels inside the red blood cells. I look at a lot of, cortisol testing, hormone testing, things like that. I do use Great Plains Lab, and I test for glyphosate in a fair amount of my patients. And certainly, my waiting list is a bit long. So what happens with a lot of my patients is my staff is really excellent at saying, why don't you get a hold of Dr. Kendra's book, which has a lot of healing diets in it, which reduces inflammation. And in the meantime, do one of the genetic testing company tests that are out there. And so by the time they come in my office, they've already been on a healing diet for 3 or 4 months, and they already have their genetic testing. So it's a very easy way to kind of get a jump start with my patients. And the genetics will
for genetic testing, are you talking about 23andMe or Ancestry or some specialty labs? Okay.
And I'm also currently in negotiations with a company from the Northwest, and we're looking to put together my own personalized panel. Because as you know, there's like 4 billion genes in the genome, and about 4,000 of them separate us from apes, and about 400 of those have implications on our health, and about half of that is stuff that we can actually modulate as physicians with diet and supplements and lifestyle suggestions. So I'm looking at putting together my own personal panel, and they're kind of in the final stages of opening up their company. And I'm really hoping to move forward with them because they're not like a standard 23andMe or a Ancestry company that will which sells your DNA for data mining. It's quote de-identified, so they shouldn't be able to identify who you are personally, but you don't know that. I mean, you really don't.
Unfortunately, in the age of that we're in with social media and everything else, privacy is pretty much out the window.
It's funny because I have patients over, who are very, concerned about, sending out, information, blood or saliva or whatever for DNA analysis. And I'm like, oh, please, they already got it. And if they wanted to find you, they would, trust me.
In the post 9/11 world, forget about privacy. As much as I would like to have privacy, I don't think it exists.
I totally agree with you. Totally agree.
So can you talk about exposure to toxic chemicals like heavy metals and bisphenol A, and you mentioned glyphosate, and how this might be related to anxiety in children?
Sure. So again, it comes down to, whatever your genetic predisposition is. So if you have, a gene, for example, like MTHFR, right, which is methyl tetrahydroxyfolate reductase. So that helps convert a folic acid, which is synthetic, into the usable form of folate. However, in order to do that, you need to recruit all the other B vitamins from your food and a bunch of minerals. So if this pathway if this enzyme is not working properly and the pathway is jammed up in some way, what ends up happening is you end up kind of using up your B12 and using up your magnesium and some of these other cofactors in a little bit of an inefficient way. And so when that happens, you're robbing your body of the cofactors for, any of these other, nutrient pathways that would utilize those minerals. So because this happens, it creates inflammation in the body. When we create inflammation in the body, we end up, eliciting an immune response. When we have an immune response, that immune response could be misdirected if the body is out of balance. And, recent research has shown us that conditions like depression and anxiety come from an inflammation state. And so, by looking at those things, the bisphenol A, the glyphosate, even heavy metals like lead, those things competitively inhibit the body's ability to use the beneficial minerals and vitamins, and can certainly throw a wrench in your cogwheel of the MTHFR, for example.
How do you test for heavy metals, and how do you test for some of the other toxins?
So for heavy metals, it varies. Sometimes I'll do blood. I'll look at an RBC lead level. I'll do a standard lead level, things like that. With glyphosate, I use the Great Plains Lab. And you asked me one other thing, but I forgot what that was.
I don't remember you.
Oh, okay, fine. So anyway, but that's how I test for those sorts of things. And as far as like bisphenol A, it's just really, for me, I look at genetics. I try to be really, mindful about people's pocketbooks. And if we can't make progress, then I will go into like the NutrEval testing and the micronutrient testing. But for the most part, a comprehensive analysis and, look at some just standard, conventional blood work can really, I would say 80 to 90% lead you down the path to help your patient heal.
So you mentioned nutritional deficiencies. Can you explain what are some common nutritional deficiencies that may have a role in anxiety disorders?
Sure. Low B12. right? So, and we know with B12, it's a little bit of a slippery slope because you can have a normal serum B12 level, but still not have the B12 where you need it inside the cell. And conversely, you can have B12 that looks normal and it be too elevated for that patient, which can also give that patient anxiety symptoms.
So are you looking at homocysteine levels or methylmalonic acid, or what marker for functional B12 status are you looking at?
I do the whole pathway. I do the B12 folate. I do the MMA, methylmalonic acid. I look at ceruloplasmin. I look at homocysteine, and I look at C-reactive protein. So, and that's generally how I do it. And depending on
for those who aren't aware, can you explain what you mean by the B12 pathway and how those factors fit into it?
Sure. So B12 comes into our bodies, via food for the most part. And then the food is broken down and the nutrients are disseminated through the circulatory system. When it's disseminated through the circulatory system and we draw blood, we can get a serum B2. That's called the serum B12 level. So that's a level of how much B12 is in your blood. However, if you have impaired pathways for whatever reason, MTHFR, COMT, any of the other cousins to MTHFR or whatever, you certainly could have B12 that looks adequate or even elevated in the blood and then not have any of the B12 inside the cell. So then you can look at a level like methylmalonic acid, which actually looks at the translation across the cell membrane for the B12 to make sure that there is adequate B12 inside the cell. It's, as you know, it's a lab test that isn't it's not 100% accurate, but it gives us a best indicator because the methylmalonic acid is a byproduct of how the cell uses B12. So it's good enough. And so a lot of times what happens with those patients is you can't give them B12 because it does make them anxious or it impairs their sleep or it makes their behavior worse. And so you have to do something else to kind of help the pathway, support that pathway. So in some cases you use B1. In some cases I use the element molybdenum, which I've had very, very good success with. Sometimes you don't do any of that and you just tell your patients to go home and eat a whole bunch of cooked green vegetables. So each patient's really, really individual and you have to kind of meet them where they're at.
What does molybdenum do?
So molybdenum, the way I describe it to my patient is it works like lubricant. It kind of lubes up the B12 to get it through the receptor a little bit faster and more efficiently. The other thing with molybdenum is it's a great, the byproduct of methylation, it tends to be very, very delicious food, quote unquote, or energy for the Epstein-Barr virus. And molybdenum tends to be really, really effective at breaking down the Epstein-Barr virus also. So it's kind of a twofold.
Interesting. It also binds with copper, so you can change your zinc copper ratio that way as well.
Absolutely.
So let's talk about diet and food and how it impacts anxiety and blood sugar.
Oh yeah, let's do that. So, the first thing is
none of our kids have any blood sugar problems, right? Because they're just eating green vegetables and
exactly. My son, my 9-year-old, plays hockey, and this is a constant conversation with him about being hangry, because if he was hangry, it'd be so much easier to figure out what's wrong with him. But with him, he gets in the car after hockey and he's like silent. And I was like, your blood sugar low? Nothing. I'm like, eat something right now. And then it's, all kids are really, really different. But when kids have labile blood sugar, they certainly can get anxious. And so that's always my first advice to patients and to teachers is before you're worried about any kind of diagnosis, feed the kid, and give them something that has a little bit of quick carbohydrates and a little bit of long-acting carbohydrates and a ton of protein. And that tends to be really, really effective as far as digestion for those kids and staying power.
I know my kids, right after they were like, when my son was done with a soccer event, there was never any problem in the car because right after the parents would always bring snacks and so they'd be carbing up right away.
Yeah. Yeah. We don't have that luxury with hockey. It's a little different. You're so beholden to the ice time gods. So these kids get dressed and they get right in the car and then you're off to the next thing. You're off to the next game, the meet or whatever activity you have. So they get right in the car. There's not a lot of social stuff unless it's the end of the season, unfortunately.
Oh, okay. So how do you manage the blood sugar levels besides just getting some carbs in after an athletic event?
So my advice in general across the board is protein in the morning. Throw out your boxes of cereal and your real milk, fake milk, or whatever. When you kind of front load kids in the morning with carbohydrates and sugar like that, they're going to peak, and then they're going to absolutely tank. And so because of that, a lot of times you can see that hangry behavior, that anxiety behavior, however kids manifest their low blood sugar. So I always say protein in the morning. For me, I've never been a breakfast person. I'm hypoglycemic myself, so I'm really mindful of where I'm at with my blood sugar. And I always say to parents, protein in the morning. I love eggs, but for me it's very cyclical. Like I'll eat eggs every day for 3 weeks and then be over it and eat something else. So I always recommend some sort of really high quality protein shake, or a piece of chicken from last night's dinner, which is a far better source of protein or nutrients to start your day than a bowl of cereal.
So for breakfast for kids, you give them some eggs. Is that it?
Everybody is different. My kids know that my kids get eggs, bacon a lot of times, and then we mix some, usually it's onions and peppers. In the summer, we do a lot of spinach and basil or garlic scapes, depending on where we are seasonally. And then for me, I would give my kids, in particular, they'll have a snack 2 hours later. That's generally nuts, So right now we're on a macadamia.
No toast or oatmeal with the breakfast, just eggs.
Just eggs. No,
Okay.
my kids don't have my kids don't have toast. Sometimes, like this time of year, they'll ask for like hash browns. So I'll make like either a white potato or sweet potato or a yucca hash brown. But who's got time for that in the morning? Not me.
Okay.
But this morning, my son had sausage and kale soup for breakfast. You know what I mean? My daughter made herself a smoothie. So
that's pretty impressive.
Yeah, absolutely. So, and
kale
then
soup
the other
for breakfast.
is,
wow.
Yeah, you don't mess around.
You've got some strange kids.
I know, right? I know. So, and then the other thing is I have a big conversation with my parents about gluten and dairy. Gluten, which is the protein that's found in wheat and wheat products, is called gluten because it's like glue. I mean, that's why they call it gluten. So if you think about that, in these processed grains, you have this overexposed surface area that allows that sticky glue protein to stick anywhere it wants. Now, we know by research that if you have the most perfect, beautiful, balanced gut and you consume gluten, you're going to have leaky gut for up to 3 hours after that consumption. So if you have a leaky gut, it can be inferred that you have a leaky brain. So in many cases, those proteins go straight to the brain. And the problem with that is that glue sticks in those areas of the brain that very well could be the anxiety center or the aggression center or whatever in those children. And so, almost across the board, 100%, I highly, highly recommend, getting rid of gluten in the diet. And that can make a huge difference with anxiety because, as you know, with food allergy and food sensitivity, you don't have an immediate reaction. You don't consume gluten and then your throat closes, or you don't consume gluten and then get immediately anxious, although some patients do. But a lot of times we have what's called a delayed hypersensitivity reaction. The reaction comes 30 minutes up to 72 hours after the consumption of the food. So you eat a turkey sandwich on white bread on Monday, and now Tuesday night you're trying to go to sleep and you have heart palpitations. That could very well still be associated with the gluten that you consumed.
So do the kids need a gluten sensitivity panel from Cyrex or one of these companies, or you just automatically no gluten?
I don't generally use Cyrex's panel. I used to almost exclusively order the celiac panel, which had the tissue transglutaminase and the IgG and the IgA. And then the insurance started kicking it back to me. So I've actually stopped doing that over the last 5 years or so. And what I do instead is I just order standard IgG testing for gluten, dairy, corn, and soy. And that seems to be pretty well supported by the insurance companies that are around here in this area. So, but a lot of times it's a diagnosis of exclusion. I never tested for gluten sensitivity until about 7 years ago, when I had a patient that walked in the office whose kid was absolutely positively, from the second she walked in the door, diagnosed with a gluten sensitivity. And the family just wasn't going to get on board until I drew the labs. And the lab that we use is anything greater than 2 is considered a gluten sensitivity. Well, this kid was over 300. And it wasn't till that point, till they saw it on black and white on paper, that they realized that their kid had an issue. Removed the gluten from the diet, symptoms went away. So sometimes you just need, like I said, you got to meet your patients where they're at. That those people needed it. They needed to see it on paper.
Right. But, if you're just doing an IgG for gluten, it might not be as accurate as some of these more elaborate panels. For example,
Sure.
I know the Cyrex panel for wheat measures 15 different proteins in wheat that can all create sensitivity reactions.
Oh, absolutely. But, really, like I said, I tend to be a real practical naturopath, and I use my diagnosis skills and my comprehensive assessment first, generally because a lot, I'm in an area that my patients are not wealthy, and they pay out of pocket to come to see me to begin with. So to be able to drop $300 or $400 or $500 on one isolated test can be very, very financially stressful for them. So I don't do it unless I don't do that kind of testing unless the patient comes back in the office and they're not better. And then I'll tend to look a little bit further. But on the outset, and like I said, I think it's about 80 to 85% of my patients are better just with that. So, I tend to be really lucky.
So you tend to just exclude gluten, or you do a elimination diet?
Depends on the patient. So generally the things that I would go to initially are generally gluten, corn, dairy, and soy. Those are the four things that are usually the absolute must to remove. And again, every patient is different. I've had patients who have just exclusively removed gluten and their symptoms have resolved. Sometimes you need to go a little bit further and add additional things, into the removal list. But I try to really be very practical and pragmatic with families, because even I had a woman who came in with raging anxiety. She had 2 young kids that she was caring for. And she's like, I'm super, super anxious. And I said, you got to get rid of gluten. And she's like, I'm not ready to get rid of gluten. I was like, all right, so call me when you are. And I would get emails from her, 3 and 4 weeks later. I'm so anxious. I feel like I need to go on a pharmaceutical. What else can I do other than removing gluten? And I'm like, nothing. You have to start there, So finally she did it and she lost 60 pounds. But, again, you just got to meet patients where they're at. And sometimes they're not ready in spite of the fact that they're paying, for your advice to walk through your door.
Dr. Becker, the gluten Nazi.
Indeed. That's exactly what my kids call me. Indeed.
How do you assess gut health, and how do you treat problems with gut health?
So again, it all depends on what's in there. I use, who do I use? I use Genova's test, which I really, really like. And I always add the zonulin on there.
So you're talking about the GIFX stool test from Genova Labs.
Correct. And I use that because it's easy to rule out whether or not there's a parasite or some sort of pathogenic bacteria. It's a relatively easy collection test. And, Genova's really great with working with parents with their insurance and really helpful with billing and things like that. So that test tends to be really effective. And then as far as treatment, it all depends on what you're seeing. I mean, if there's a parasite or a bad bacteria in there, you got to get rid of that first. If it's just a matter of, commensal bacteria being out of balance, then you got to support that. But that test is really great at giving you a nice smattering of, what is wrong and what is right. And so, I use a lot of probiotics. I use a lot of, gut healing combination products.
So how would you support commensal bacteria out of balance? Let's say you have potentially pathogenic bacteria elevated and maybe slightly lower levels of certain commensal bacteria. How would you address that in a particular patient?
Well, it depends on the patient and depends on what bacteria is high and what bacteria is low.
Okay.
So sometimes, you can use things like chlorophyll, right? You can use molybdenum, which, helps with acetaldehyde. You can use, immunoglobulins or colostrum. It all depends on what you're seeing. Sometimes you give specific strains of probiotics based on what the patient needs. You can use specifics, just Lactobacillus gasseri or Lactobacillus, acidophilus, depending on what you're trying to really support in that patient. So it's difficult to say what I do because I'm not an always or a never kind of girl. And
so if lactobacillus is low, you might particularly try to support that particular type of bacteria?
Yeah, absolutely.
Okay. And then what if there are pathogenic bacteria and or parasites? What type of treatment will you do then?
Well, it's different for every patient. I have prescribed antibiotics. I've used herbal combinations. I've used, liquids, tinctures, all kinds of stuff like that. I've used mastic gum. I've used glutamine. It all depends on what the bacteria is and what the symptom picture is for that child.
So mastic gum is something you use for H. pylori?
Absolutely.
Okay. What about nutritional supplements for children with anxiety?
So again, it depends on the kid, and you have to figure out where the anxiety is coming from. Is it a food allergy problem? Is it a cortisol issue? Is it a lack of sleep or a home stress? And things like that. You certainly could use amino acids like glycine, which are really, really effective. Sometimes you just give vitamin D.
What does glycine do?
Glycine binds to the same receptors that benzodiazepines do. So it works like a benzodiazepine without the addiction. Give vitamin D. Vitamin D is a precursor to dopamine, which is a happy hormone. So those sorts of things can be really effective in kids. Fish oils, it all depends on, sometimes they just need a probiotic.
What kind of levels of vitamin D do you supplement with children?
All levels. Generally I try to keep my patients between 55 and 80 or 85.
That's pretty aggressive.
Yep, I do what I can.
Good. So let's, I know you've touched upon genetics a little bit. Can you talk a little more details about a few genetic factors? I know you mentioned MTHFR. What are some of the other genetic factors that can play a role in anxiety in children?
Sure. There's another genetic mutation or marker called COMT, catechol-O-methyltransferase. And that basically works like the garbage man of your neurotransmitter system. So it picks up all the old used up neurotransmitters. So if that system is not working properly, you basically have all these random neurotransmitters that have never been recycled that potentially could refire at any time. And then when you have the refiring, you again create inflammation. And so people that are what's called comped up regulators. I always compare the comped up regulators and the comped down regulators to the Eeyore versus the Tigger, right? We all love Eeyore, but we all know he's chronically depressed, right? And we all love Tigger, but we all know he's got ADHD. And so, that's kind of how we look at it. And the truth of the matter is that, there are definitely, personality types that go along with individuals that have COMT. Like they are, what we call the 0 to 60 types. They can be provoked very easily and then get very angry very quickly. And so that's, a classic sign of a comped up regulator. The problem with that is when you get angry, you raise your cortisol. When you raise your cortisol, you raise your blood sugar. When you raise your blood sugar, you increase the leakiness of the blood-brain barrier. So it's a big, trickle down effect. And so based on that, what we also know about people that are expressing their COMT mutation is that they can be estrogen dominant. And we know that estrogen, in general, whether it's, real or fake, can cause leaky gut. And so leaky gut, because, and 90% of our neurotransmitters are manufactured in the gut, really needs to be intact for proper, neurologic functioning.
So let's say you do have a patient with 1 or 2 copies of the COMT single nucleotide polymorphism, variant. How do you treat that?
So again, it's very different because sometimes you have patients that are comped up regulators that are very, very sensitive to B vitamins. Everybody needs methyl B12, period, end of story. It's the gasoline for our cells. However, if you give a lot of methyl B12 to somebody who's a comped up regulator, you can make them super anxious, really mean, or kind of hate you. It doesn't matter.
What do you do then?
So depends on the patient, right? Sometimes you have to use a different form of B12. Sometimes you don't use any B12 at all and hope that they can tolerate green vegetables. Sometimes you give them B1 or B2, or sometimes you give them a B complex that avoids B6, 9, and 12. It all depends. Sometimes you just start with minerals.
What other form of B12 will you use besides methyl B12?
It depends on the patient. So it could be adenosine or hydroxy.
Okay. And what about patients who have downregulated COMT?
So if they are not methyl sensitive, sometimes those are patients that require higher doses of B12. So it all depends. Sometimes you have to support the adrenals. Sometimes they have Epstein-Barr. You get a whole wide variety of patients across the board. And unfortunately, there's no one size fits all.
Okay. What role can exercise play in reducing anxiety in kids?
Well, we all know that exercise is the number one misused drug in this country, right? It is completely underutilized. And so by exercising, we know that we, first of all, burn off a lot of, simple carbohydrates. And number two, it increases all the happy hormones and the endorphins in the brain. It improves sleep, can actually balance brain waves and certainly help a physical body release any kind of, tension or stress that it's holding. And I think it's grossly underused in this country for sure.
Also increases brain BDNF levels that promotes learning.
For sure. Absolutely. And it also helps with the translation of short-term into long-term memory, I believe. But I think BDNF does that too, really.
Yeah. Yeah. It's interesting how many schools now, because of budget problems and stuff, have cut back on exercise programs and phys ed and
recess even.
Yeah. What other lifestyle factors can be helpful for helping kids to manage anxiety disorder?
So as a rule, I say no screens whatsoever 2 hours prior to bedtime. Come up with a pretty, I hate using the word regimented, but regular bedtime routine.
Well, what if all their homework is online and they have to submit it online?
Well, in my practice, I have kids on IEPs and 504s, and I regularly write letters to not do any homework. It's just part of my treatment plan. I don't believe in it.
What age is that?
I use it for all ages because I don't believe in homework. Nope, absolutely not. It's like your brain's like a muscle. It needs a rest. You're going to go to the gym and work out for 6 hours and then go home and work out for another 4 hours?
What school is going to allow your kids not to do homework?
If they have a doctor's note, they get it done in school.
Really?
Oh yeah. Yep. And for the patients that don't require a doctor's note, that have 504s and IEPs and all that, it's the first thing I tell them to say. You go in there with your advocate, if you have an advocate, and tell them no homework.
Wow.
So there's no evidence that shows that homework that kids are doing at home is actually, number one, we know the test scores have gone down in the last 9 years since Common Core, number one. Number two, that homework actually increases or enhances learning in any way.
Wow. You should just put that on your website. The kids that I treat don't do homework.
Oh my gosh. Yeah.
Your waiting list is going to grow to, you have a 3-year waiting list.
Well, and there's lots of schooling programs that don't require homework. I mean, Montessori doesn't give homework, granted the Montessori schooling program is generally over by 8th grade. Waldorf generally doesn't start homework till around 5th or 6th grade. And that kind of homework is very constructive. It's all project based. You're not sitting there, writing answers on a sheet that somebody thinks is the right answer. It's a creative project. So it's really only the public school that's challenged. I mean, countries all over the world don't do homework. It's only here.
Wow. Yeah. I mean, my kids are both in college now, but they've had hours of homework every day for years and years and years. So it's surprising to hear that. What about strategies for managing anxiety like meditation, yoga, breathing?
Yeah, all the things. So I teach the kids in my practice the I love you, good night. It's what I call the I love you, good night. And so what I teach them is that when they get in bed, they start with the top of their head and they say, I love you, good night to every single one of their body parts. I love you, good night, forehead. I love you, good night, eyes. I love you, good night, nose. And they do this throughout their whole body. I've never had a kid that's gotten past their knees.
Wow. It's sort of a variation of the progressive relaxation strategy, right?
Absolutely. But you can't teach a 6-year-old, how to do progressive relaxation. So you just, it's really a take on counting sheep. It's just a repetitive calming exercise.
Right.
But, we all know yoga, any kind of these relaxation exercises, prayer, devotions, whatever it is very, very beneficial for sleep. So, and sometimes what you have to do is it's not even about what the activity is. Here's a funny thing. Before I became a doctor, I was a nurse. I went to nursing school, and I went to nursing school long before nursing was what it is today. Like, we held our patients' hands, we talked to them, we sat on the edge of their beds and asked them, how they were feeling. It's a different kind of experience that nurses have now. And I'll never forget, you wait all this time to get into these nursing classes. And I get into my first nursing class, and the teacher said to me, or said to the class, she said, you have to remember that when patients are anxious about sleep, you can tell them that it's okay to not sleep and just lie there and take a rest. And for me, still after all these years, that absolutely resonated. And so I tell that to my patients all the time, because there is nothing worse than having anxiety about not being able to sleep when you're trying to sleep and then you can't sleep. It's just awful.
Right.
So, sometimes it's just a matter of making a space for those people, those patients, and even kids, because kids have that level of anxiety at this point too, that, you just tell them that it's okay and just don't do it. Just lie there and take a rest.
How about talk therapy for anxiety?
I think it depends on the talk therapist, and I think that's really a decision that has to be made by the sufferer and the family, because I think in some cases talk therapy can be really, really effective. The problem here in Connecticut is that there's been a lot of legislative action around what can actually be discussed in talk therapy. And I think that, when you're going to a licensed provider, you're regulated by the state. And so I worry about that. I almost think that talk therapy could be much better in the confidence of, somebody who's qualified but isn't a licensed therapist, if that makes any sense, like maybe a Reiki practitioner or, a local pastor or somebody like that.
Interesting. What about cognitive behavioral therapy?
Again, I think it's a personal choice.
Okay.
I think there has been some success with it. It's generally not my first line of recommendation unless a patient, actively seeks it out themselves. But I think, you have to remember with any kind of therapy, it's a little bit like dating. Like, you have to remind patients that, you're not going to schedule an appointment with a therapist that your friend liked and loved and go in there and have a magical relationship. You may have to see 2 or 3 different therapists before you find the one that's really effective for you.
Last question. I read in your blog post that you find chiropractic helpful for children with anxiety.
Absolutely. So my husband is a chiropractor, so I'll preface my statement by saying that. But we know that chiropractic, removes interference, and we know that things that cause interference in our body makes us sick. And so when you get a chiropractic adjustment, not only are you removing interference from a spiritual level, but you're also increasing endorphins and oxygen and, healing, immune, components of your immune system into your brain and into your nervous system. So of course it is beneficial. And I've had lots of patients too over the years that have come into my office that, I've said to them, I'll be happy to sell you, a room full of supplements and do a ton of lab testing. But I think a lot of what you're, experiencing is coming from your spine, and perhaps you want to try chiropractic. And sometimes it's all they need. Sometimes they will require a combination, but chiropractic can really be a game changer for people. And I think the biggest challenge is people don't normally think of treating something like anxiety or ADHD or even autism with chiropractic as a primary form of treatment.
Interesting. Music to my ears as a chiropractor.
I know, right? Right.
So thank you for the interview. And for those listening, how can they get a hold of you and find out about your programs?
Sure. So my website is drkendrabecker.com. That's where my blog is and all of my speaking engagements and things like that. My office website is Family Wellness Center of Connecticut, or fwcct.com. And there you can schedule appointments, purchase supplements, see what kind of classes we're offering at the office and things like that.
That's great. Thank you so much, Dr. Becker.
Oh, my pleasure. Thanks so much for having me.